Welcome to the Filipino Nursing Diaspora Day, which will be celebrated today, 7th of May 2020, which happened to coincide with International Nursing Week celebration, which started yesterday, May 6, up until May 12. The theme for this year's Nursing Diaspora Day is creating connections and shaping the evolving role of the Filipino nurses. The theme provides an opportunity to enhance the collaborative professionalism of the Filipino nurses in various parts of the world and recognizes their significant contribution in advancing the health and well-being of our society. This year's celebration is extra special because the World Health Organization has designated 2020 as the Year of the Nurse and Midwife. Before we proceed with the webinar proper, let me give you some protocols here. Number one is that all the participants are muted. They will be unmuted during the Q&A portion. You can send your questions on the chat panel. You have to introduce your name during the Q&A portion. The presentation will be recorded. It will be available on YouTube later. And then finally, we will have a groupie or group photo shortly after the presentation. We would like to recognize our sponsors and event partners: Elite Migration Consultancy, Bethany Delta Nursing Society, Philippines Times, Ang Nurse Party List.
Hello everyone, my name is Glyce Alexa Sam, and I am the CEO and Principal Migration Agent of Elite Immigration Consultancy. I took up Australian migration law practice from the University of Victoria. I also graduated Juris Doctor from the University of Technology, Sydney. Elite Immigration Consultancy is a registered and licensed migration firm which provides elite quality but affordable migration consultancy and visa services to individuals, employers, and corporate clients. The firm operates in 2 regions with a main office in Kent Street, Sydney, Australia, and offshore office in the Cebu City, Philippines. The firm offers the following services:
As Jerome mentioned, I am the current Director for Professional Development of our FIND network. And today, my task is to be able to pull us along within the time limit that we have for our webinar, as well as to introduce our guest speaker. Okay. And so for the introductory welcome and everything, I would like to then hand over to our President, Dr. Violeta Lopez.
Violeta?
Yeah.
Okay, go ahead. Sorry.
Saying good morning or good evening or good night, wherever you are joining the webinar. In light of the COVID-19, this year's celebration of the International Nurses and Midwives have taken a different shape in commemorating the invaluable contribution of Filipino nurses worldwide. But our network, FIND, will continue to commemorate this contribution of our nurses by providing you with webinars that are being presented by our distinguished guests from around the world, who will share you their experiences, their updates, their thoughts about the nursing excellence and the nursing profession worldwide. So I hope that this seminar will give you some inspiration, which is really important because resilience is very important nowadays for our nurses who are working during this COVID-19 pandemic. So I hope that you will learn a lot and appreciate what is going to be presented to you. And I hope that you will continue to subscribe to the ongoing webinars that the FIND network will be advertising through our network or through the Facebook. So again, welcome to this seminar, which is part of the Diaspora Network. Thank you and have a satisfactory day. Cindy, your turn.
Thank you, Cindy.
Okay. Hello, everyone, again. Okay. This is Dr. Cindy Lee, and you know, today I am very honored to introduce our resource speaker, Dr. Rhoda Redulla. Her glowing nursing career and achievements are actually detailed in the speaker bio that is uploaded in our FIND website. Let me highlight some aspects. Here I need to read my notes so I don't miss anything. She completed her Bachelor of Science in Nursing degree from the University of Northern Philippines in Vigan City. Then completed a postmaster's certificate in nursing education from the University of Pennsylvania. She obtained her Doctor of Nursing Practice degree with honors from the Johns Hopkins University and was named their outstanding alumna in 2019. Dr. Redulla's experience and expertise is evidenced by her several prestigious nursing involvement, roles, and positions. To mention a few, she has authored and co-authored books, book chapters, and peer-reviewed articles. She contributes to the Cochrane Nursing Collaboration and is the systematic reviewer for the Joanna Briggs Institute. She is also a reviewer of several other international journals. She has presented in numerous national and international forums, such as the Nursing Times Directors Congress and the WHO Public Health England Conference. She chairs the Society of Gastroenterology Nurses and Associates Education Committee in America. She also served as Director of Clinical Education at Salem Medical Center and was Director of Nursing Practice at the Hospital of the University of Pennsylvania. Currently, she is the Magnet Program Director at the prestigious New York-Presbyterian Weill Cornell Medical Center. Quite impressive, don't you think? In this webinar, Dr. Redulla aims for us to be enlightened and inspired to pursue excellence in our teaching and learning, our nursing practice and community engagement, and our varied research endeavors. So without further ado, let us welcome our illustrious nursing colleague, Dr. Rhoda Redulla.
Thank you so much, Dr. Lee, Dr. Cindy Lee, to Professor Jerome Babate and Dr. Violeta Lopez, the entire Filipino Nursing Diaspora Network. I am very honored to be part of the Filipino Nursing Diaspora Day and really Nurses Week and Nurses Month celebration across the globe. Thank you for inviting me and making me a part of your celebration webinar, and to everyone who are tuned in to tonight, today, this morning, because I know Philippine time is around 10:17 in the morning. In Sydney, Australia, it's about maybe right after the noon hour, right, Dr. Lee?
Yes.
And
Yes.
here in New Jersey, well, New York, that's where I work, in New Jersey, I'm in our dining room right now. It is 10:17 in the evening. And I am just in awe on how we were able to pull this together and connect as an international or global nursing community, sharing knowledge and skills across the globe. And that got me very, very excited when I got the first message from Jerome earlier this year. But that was a few months ago, a couple of months ago. And when we were planning, if you are looking at our title, Pursuing Excellence, Moving Forward with Resilience, you're probably thinking, pursue excellence. Like, that's the last thing on my mind right now amidst this horrible pandemic. And that's exactly what I'm thinking and what we were thinking as well. But if we look again or think again, who do we turn to? Who does the world turn to if we do not move forward, right? So I think truly aligned to what we are asked to do as nurses and as healthcare workers. We pursue excellence and we move forward with resilience, and that's our focus. That's our title and our focus for our webinar tonight. So Dr. Lee very much outlined our goal, and my goal for each one of you, is to live this session today enlightened and inspired and ready to change the world again. That's what we do every day, right? We get up and we go out to change the world. So I will now pull my PowerPoint, and hopefully you will be able to see my screen and click my screen right here. Does everyone see my screen?
Yes.
Yes. Yep.
All right. Thank you. So again, I welcome you to Pursuing Excellence, Moving Forward with Resilience. Again, happy Nurses Week, Nurses Month. I just wanted to share with you our American Nurses Association theme for the 2020 Nurses Month celebration, which is Voice to Lead, Nursing the World to Health. And I love this picture. Who loves this logo? It says nurses are heroes, and you've probably seen this in various forms, whether it's in a drawing, video, or like every way it could be depicted, where nurses are heroes. And I also would like to recognize the theme of the Filipino Nursing Diaspora Day, which is creating connections and shaping the evolving role of the Filipino nurses. And throughout this presentation, I will take you on a journey how we can all connect the dots with the Nurses Week celebration and our role, not only as Filipino nurses, but as a nurse, period, right? The World Health Organization, as you all know, has declared 2020 as the International Year of the Nurse and Midwife. And I'm sure you already have heard why we are celebrating and why it was declared as the International Year of the Nurse and Midwife. On Tuesday, which is May 12th, Florence Nightingale would have celebrated 200 years. It would have been her 200th year birthday. And how amazing is that, right? We are here now 200 years after. And again, as they say, this is the Nurses Week and Nurses Month that will be like no other because of the greatest challenge that healthcare has ever faced. Our agenda, really quickly, is we will be having great discussions on how to create your professional roadmap. We'll be talking about self-assessment and SWOT analysis, right? Probably you're thinking about what SWOT analysis has to do with creating my professional roadmap. You probably hear that term when you are talking about organizational strategic planning and other applications. How do you become an expert? And again and again through this session, how do I even think about this when I am just thinking of my next day tomorrow, going back to a burnout, stricken healthcare environment? But stay with me and we'll break this down and I will bring this together, like let this come together as we finish the webinar. And under becoming an expert, we will be talking about what's the value of academic advancement and continuing education, membership and active involvement in a professional organization, okay, to start thinking about the professional nursing organizations that you are involved in now, or if not, the ones that you are planning to be involved in, and certification. Lastly, the second segment of our title says moving forward with resilience, and how do we achieve that? It's filling your bucket, staying resilient. We'll talk all about that. So I will start with a question, and I love interactive sessions. So if you look on the bottom of the screen, you will see a chat button, right? So I want you to click on that and make sure that when you're responding, you click to everyone. Okay, so my first question is, as a nurse, what is, I'm sorry, that's a typo. What is your big dream? So I'll give you a few, maybe of a minute or a few seconds to type that in, and I'll look. I'm trying to look through the all right, I'm seeing a response here. Unleash others to be great nursing leaders from Janine Lamzon. Hello, Janine. I'm waiting for more answers. And Dr. Lee and Dr. Lopez, Professor Babade, you're welcome to type in as well. You are not excused.
That's all right, but this is Cindy.
If you are too shy to type in, then you can just respond to me, so at least I see it, right? Wow, I'm seeing some nice answers too. My big dream is to be a positive contribution for others. From Irene, Marco Polo Pescador is to improve primary health care in the Philippines. Wow, we will be with you on that one. And Jerome, getting a fellowship. Let's make that happen, right? Okay, well, continue thinking about that. Okay, I want you to continue thinking about that. And let me go back to my next question here. Next question is, 5 years ago, what was your big dream? And I will not ask you to go in there anymore and respond, but I want you to stop and think about this. This is your opportunity to reflect and think through 5 years ago. So that would have been roughly, what, 2015? What would have been your big dream? And I'm asking that because over my years of nursing and mentoring others or working with others, I often hear fellow nurses say, oh, I want to do this, I want to do that once, you know, this one is over, or if only, or like a certain, you know, quite a long list of ifs before they can get to the next pursuit that they have. And I would often find myself engaging in conversations, trying to explore what are those barriers, what are those obstacles that they're encountering, or that everyone is listing, that would stop them from pursuing their dream. And our goal for tonight is come up with an answer that when you are thinking of your big dream and when is the right time to do that, the time is now, because nursing needs you, the world needs you, and you really need to invest in yourself to help the world move forward and help really make nursing advance to what we all aspire it to be as a profession, right? And I will share with you here a few people, because so many people inspire me. Many nurses inspire me. You all inspire me as nurses. And I just wanted to highlight a few of nursing colleagues here who inspire me. And I will start here with Peter Sofan on the left. So you will see Healthy Nurse, Healthy Nation. This was a feature in the Healthy Nurse newsletter where Peter was really highlighted in his efforts to lead his team in improving the work practice environment. And we very well know that if the work practice environment is great, a lot of things follow, right? A lot of great outcomes follow. And I will just share you my, one of the facts right now that is well rooted in the evidence on pursuing magnet or nursing excellence, where there are top 3 drivers of, or the top 3 outcomes that many healthcare organizations are aspiring for. Number 1 is patient experience or patient satisfaction. Second is nursing engagement or nursing satisfaction in other languages or other literature. And third will be clinical indicators. And it is fascinating to see that when the nursing engagement and nursing satisfaction is high, everything else follow. And when I do go around and do my talks, I say to, and even to our new nurses, I say, I am so proud about that. That makes me so proud as a nurse, because that means that we make a difference. And that's exactly what Peter's work is. His focus is on healthy work environments. And through his team, he is the patient care director of the ambulatory surgery department in our hospital at NewYork-Presbyterian Weill Cornell Medical Center. And Peter is a certified Pilates instructor. So what do you expect, right? He really fosters health and wellness, but he also does this innovative strategies to engage his team, including, for example, during the holidays, he has this program called Holiday Reset, where the whole week is devoted to self-care. Like Monday is Meditation Monday, Wednesday is Wellness Wednesday, and so forth. They even have a karaoke day and so forth. But the bottom line is that Peter was able to lead his team and able to get his team engaged and achieve great outcomes. So I'm sharing that. He inspires me. On the top picture here is Kate McNamara. Kate McNamara is a very good nursing colleague in England. I'm not sure if you have heard of her story, where Kate is the nurse who circumnavigated the globe. Kate visited us at NewYork-Presbyterian Weill Cornell as part of that mission. So Kate was selected for a scholarship by a nonprofit organization in England. I think it's the Queen's Institute, where they really wanted to see, because, I'm not sure if you've heard about the the nursing shortage, the ongoing challenge with nursing shortage in the UK. So the NHS, the government wanted to look into what can they do to support nurses, right? And to support everyone who is, or the source of nurses from who are working in the United Kingdom. So what they came up with is a scholarship where a nurse for 4 months will be released with pay. How awesome is that, right? To go to every country and place where nurses from the UK come from. And of course, one of them is the Philippines, right? So Kate actually went to the Philippines, and we had a great conversation on her experience there. And the last leg of her journey, this was in 2018, was in New York, because they also wanted to learn culture, the nursing practices and culture and best practice from the United States. So that's how I got to know Kate, and I'm including her here because she really, truly made a difference in communicating and advocating for nursing in England. She's still in Nottingham University Hospital, but she has then come up with a report. She has a blog where she is an influencer, communicating what she has learned throughout this 4-month journey. And on the bottom here is our team at New-York-Presbyterian. So we actually have our evidence-based practice and research nursing council. And some of them here are some of my favorite people. So I will just highlight to you here in the middle, for example, is one of our very young nurses, Stephanie O'Neill, who is a clinical nurse at our renal transplant unit. And just highlighting that Stephanie is a second career nurse, with her first career as a biomedical engineer. And I was so fascinated with her skill set as a biomedical engineer being merged into nursing, right? And taking that then into evidence-based practice and research in advancing nursing science. And I can also speak about Sabrina, narrative nursing, and Amy McManaman. I can go on and on, but all of these nurses and many others, and many of you in the audience, inspire me. And more of inspirational, I think I will be remiss if I will not be able to share with you some aspects of my journey as a professional nurse. So you will see here Kevin Beaton, who is, like later, of course, I've known it, who became the Florence Nightingale of the Philippines. But I will, step back and just share with you that in, like it's already about 2 decades ago. 2 decades ago, right after I pursued my master's degree in the Philippines, I really wanted to advance my education and pursued a Doctor of Philosophy at the University of the Philippines in Manila. And one of our classes at the time was nursing history, right? It's in the doctoral program, and it was. I love history, so I was again so engaged in the class. We didn't really have a lot of structured lectures, but we had more of like a qualitative approach to teaching and learning. Our professor, many of you probably know her, a nursing legend in the Philippines, Sister Letty Kwan, or Dr. Letty Kwan, who challenged the class to come up with a collated work of the nursing history in the Philippines. I think there was a book at that time that was available, but maybe it was not as comprehensive as she had envisioned it to be. So she challenged us, okay, class, she said, there were 7 or 8 of us, go back to your provinces, go back to your cities, and come back with a paper, write and research on the nursing history of whatever it is, your town, your city, and your province. And of course, I took that to heart. I went back to Vigan, my hometown. That's where I grew grew up, and I spoke with many nurses, nurse leaders, retired nurse leaders. I visited every museum and unearthed every possible evidence that I could. I learned about how evidence could be, like this precious evidence could be ravaged in fire, and like everything. I did everything. And then one day, I heard about the oldest living nurse at that time. And they said, oh, you should go see Mrs. Beating. And she lived, quite a distance from us, and it was in a remote area in the province. But cut the story short, I found her. She was 96 at that time. And I'm sharing this with you because to this day, my conversation with her that afternoon, late afternoon, it's still so clear in my head, and it gives me goosebumps every time I think about her stories. So to get it more exciting, I left her house that evening. She handed me a copy of her memoirs. And it is, I think, one of the most precious nursing possessions that I've ever had. And to this day, I said, this will be one of the most treasured mementos I have. So she served, she served as a nurse she was one of the first nurses, actually. So how I discovered her, I saw her name in one of the documents that I encountered, and then they said, she is still here, she's still alive, and I talked to her, and she told me stories in her memoirs. When we think about being a healthcare hero, wow, I said, this is a healthcare hero. Mrs. Beating is a healthcare hero. She cared for wounded Japanese soldiers at gunpoint, right, during the war, making sure that these soldiers survived. Otherwise, it was her life that's at risk. Or administering, looking for the next baby who needs shots, crossing rivers by foot. And I think to this day, we still hear those stories, of course, but hearing that firsthand and in a way where in a way that she conveyed with such compassion and commitment, it's just really huge. So again, cut the story short, I was happy with my research. I finished the paper, I submitted the paper, and I finished that. But after that course, shortly after that, I was midway through my doctoral program. I became pregnant with our first child, and I had a very difficult pregnancy. So sadly, I had to stop. And I was at home. I remember I was on my maternity leave, and I was looking through my work, and I said, I feel like I needed to share this to somebody. I need to share this to at least way past my class. And so I went in the computer. I remember it was still a dial-up internet at that time. This was in 2001. And I just, searched nursing history, health history, medical history. I was really looking for a journal where I can share this to. And again, this is a lesson that we will talk about more later. I said, duh. Now thinking back, I probably could have asked my local nurses association, my Filipino Nurses Association, and would have been a great platform for me to share that. But of course, I wasn't thinking that way at that time. But I found the website right here. You see here, Society of Philippine Health History. And I saw an email contact, and that was the email of Dr. Weill R. Is familiar to some of you. He is a cardiologist in the Philippines and had a passion for health history and actually pursued a health history degree here in addition to his medical degree here in the United States. And I just emailed him and shared him exactly as I'm telling you now. I finished this class. I wanted to see how I can share this. And the next morning, I got an email back from him, to my huge surprise. Of course, whoa, I got an email back. And Dr. Ong said, send it to me and I will review, and I would love to hear more about your work. So I sent it to him. He loved it, and he decided to publish it on the website of Society of Philippine Health History. And then I learned after that that he was actually a columnist for Health and Lifestyle magazine. And he asked me, he has a column there, it's called A Slice of History, which is about medical and health history, and asked me if I was willing to break down my work into several articles and feature it as a series. And I said, would I agree? Of course I would agree, right? But it was a huge goal at that time. But again, that happened. I was very, I was still, you know, I could not believe what happened with that simple search. I'm sharing with that not for any reason, but to share with you that when you want to pursue something, big dream or not, it doesn't really hurt to take that first step. And of course, I didn't know where it was leading at that time. And I'll continue with that story. So after the column was published, he asked me, Rhoda, I actually have a book. And I'll share with you. His book at the time is the Medicine Blue Book, which is, I later learned was one of the fundamental texts of medical students, you know, for medicine in the Philippines. And he said, I've really been trying to transform this into an expanded Medicine Blue Book version and create a nursing portion of it. But I've been struggling to find someone who's willing to like do this with me. And he asked, the next question I knew was, would you willing to work with us on this? And I said, I don't really know anything about writing a book, but if you tell me what to do, I'll follow your lead and we'll take it from there. And he said, yeah, I'll work with you. And I'll make sure that you will not feel overwhelmed with anything. Okay, so shortly after that, he asked me, and then it, you know, cut the story short. Now it was published. At that time that it was published, this is not the fourth edition, but in 2003, we already in the United States. We just arrived here as new immigrants, and we were living with my aunt and uncle at that time, and a package arrived in the mail, and it was the book. So I could not believe it, but again, I'm sharing this with you, but if you can appreciate the connection of really just starting with like nothing, or like a little pursuit that led and snowballed into something greater than I've ever imagined. And the last I connected with Dr. Ong, I think they are already working on the 7th edition, and he still, you know, connects with me, and we update the book accordingly. So this is when we went home in 2012. It's a really nice memory. I emailed him, and you know, he came to meet me wherever he said I was. So this is my daughter, and that is Dr. Lisa Ong, his wife. All right, so I put here the word positive audacity, which, you know, sometimes you think about audacity and it could go the wrong way, but that's one thing that I would leave to you today. Be bold, be brave, and just proceed positively, pursuing excellence, right? Okay. So here, how do you pursue excellence? How do you achieve your big dream? And we talked about the outline, and I'll start right off here. First, you have to create your professional roadmap. Wow, is there a GPS, you know, is there a Google map for creating your professional roadmap? I wish there was that, like if you say, I want to be like this in 10 years and put that in, right? And you see exactly how you want, or you what steps to take, what courses to do to pursue, what network to follow, and so forth, right? But it doesn't work that way. So we have to step back and do first a self-assessment. And if you look at books in professional development, you will really see how they would advocate for looking into the specific steps. And there's an acronym which goes by SWOT, right? This is very popular or a popular tool in doing organizational strategic planning. It's like an org-wide strategic planning, but you can really take those same principles into your personal development or your own professional development. So first, what are your strengths? W, weaknesses. O, opportunities. And T, the threats. And let's take that step by step right here. What are your strengths? And I love a cartoon here that I found on Google image. Like, you can take a moment and look at them. Wow, what are your strengths? Are you a performer? Are you an analyzer? Are you a diplomat? Are you an artist? Are you a motivator? Are you a pioneer? Are you a warrior, right? We've been hearing that word a lot lately. And I think if you read this, wow, is there a place in nursing? Is there a place for this in healthcare? Absolutely, right? So if you remember, Peter, I'm just looking at this one, performer, Peter Stofan, who I shared with you earlier, who is the patient care director of our ambulatory surgery service line or department. His first degree is actually music, and he is of course an accomplished nurse, but he has this beautiful professional advancement story on how he on his journey into his nursing career, and he takes now his skills as a musician, as a performer, into engaging his team and presenting and all the great things that he could do, right? So back to this, your strengths. So stop for a moment. What are your strengths? What are you naturally good at? What are your talents? What skills have you worked to develop and really invested your time to make sure that you are good at it? I'm reminded of a quote, and I really love to recite this in my head a lot of times, especially when I catch myself not speaking well. One of my former mentors, shared with me saying that, Rhoda, there are two kinds of people. Some people are better read than heard. I think I'm that. And some people are better heard than read, right? And maybe some are, maybe they're good at both, or they probably have an opportunity in both. So reflect on that, not necessarily on that skill, but what are you naturally good at? Do you love data? Do you love calculations? Do you love organizing? Do you love helping, reaching out? Do you love being a part of the community? Anything that you are good at, there is a place in nursing and in healthcare, right? Again, the W in our SWOT is, what are your weaknesses? What are negative habits and traits that you can think of? We're veering away from the word negative, but again, the O is opportunity. So I had to use the negative. And this, by the way, is from an article by Martin. I can share with you the reference list. And what are your skills that need improving? So think about that. And as you are doing your SWOT analysis, I think I want to just share with you as well another tool and platform to be able to do this, which is peer feedback or peer review. You've heard about that. Is that an organization that is another colleague of equal role, the same as, like something that's synonymous to your role, giving you both positive and constructive feedback, and taking that and reflecting on that and coming up with your goal for the year. Okay, but we can go back to that later. So I'm saying here, what are these your weaknesses? And you can do self-reflection, but you can also reach out to a peer and have that conversation, right? What are your opportunities? Is there something there's new technology in your industry? When I meet with our nursing leadership team and, our chief nurse, every week in the agenda, you can't leave a meeting without talking something about technology, right? So what's new? what are opportunities for you to learn from, or maybe opportunity for you to be good at and shine on? What new regulations evolve that have an impact on your current field? I'm reminded right now of the educational requirement, for example, in 2017, where New York State passed the first BSN in 10. That means BSN in 10. That means that the minimum requirement for an entry-level nurse, 10 years, for 10 years from 2017, would be a bachelor's degree. So now our colleagues in other parts of the world who are tuned in right now, you probably are confused, like, what? Well, our entry level is a baccalaureate in our country. Well, that's not the case in the United States. Yet it's an opportunity that we are working on, and it's actually one of the messages right now that I'm leaving to you, not just in the baccalaureate degree, but continued academic advancement, right? So again, if that has an impact on your current field or practice, make sure to take that into your SWOT analysis. What are the biggest external dangers to your goals, or what are the strong areas of competition for jobs you are best suited? Are you in a field where it might not be as marketable, in the next 2 or 3 years, or even further than that? So envision that and see where you want to take your career. Okay, so you get the point. And this is just for fun here. I found out, that I found this illustration, or this image, that there are actually some hidden talents of people. So my message is, this one says about based on your zodiac sign, which is, I think, some for fun. I was looking at myself, I'm a Virgo. Wow, I have a hidden talent for writing. Probably true, but you can look at that quickly just for fun and take a deep breath and say, "Ooh, I have a hidden talent in dancing or sketching," right? So all of us have hidden talents, and make sure to look at that. So the next step then is, okay, I did my SWOT analysis. I now have a self-reflection of where I am. So what's next? So the next step would be to make sure you are examining your curriculum vitae, or your CV. How often does a car need oil change? Or how often do we need haircut? Well, right now we're not even thinking about that because we can't get any of those. But our CV, definitely the same thing. You have to look at it periodically. I would say at the minimum every 6 months, and look at it and see where your strengths are and where your opportunities are, and all of that. And then develop SMART goals. Nurses are very good with developing SMART goals. Make sure it's measurable, attainable, and so forth. You have a time frame for it, and do a gap analysis of what you currently have. You may find out that, wow, I've done so much research, or I've done so much speaking, or I've done so much community outreach, but lagging on this aspect. So that's where your goal will be driven in the next year or so, right? Second one on our agenda is pursuing excellence. We do that by becoming an expert. First is to pursue academic advancement, and I will just show you quickly here because I'm just looking at our time and being sensitive to our time frame. There is a full range of opportunity for each one of us, up to the doctoral level, to the postdoctoral level. And I just got a quote here from the AACN, which is the American Association of Colleges of Nursing. Nurses looking to advance their expertise and impact healthcare delivery at a higher level should be encouraged to complete a master's degree and a research-focused or PhD or a practice-focused doctorate, or there could be other degrees in other parts of the world. But the bottom line is pursue academic advancement. One lesson that I learned early on in life, it was during one of our high school academic recognition programs when the speaker said to us, I was a young high school student, and what he said was, never stagnate. And that stayed with me. And I will add to you now, never. Okay? So make that vow, keep going. I am a believer of lifelong learning. And I'm sure many of you are thinking right now, it's not that easy, you know, and it's a long journey. If I'm thinking of pursuing a master's degree, a doctoral degree, oh, there's so many obstacles that can come up. But again, share with you a favorite quote from Og Mandino: great achievement comes from working and waiting. And for me personally, when I was pursuing my doctoral degree, I was, again, a very busy mom. I was an immigrant. It was unthinkable. But what I would think about every day is that there were 25 of us in our cohort, and each one of us have our own challenges. I had, if I was a mom, I had another classmate with 3 or 4 children, or I had another classmate who was dealing with ailing parents, and each of us just kept going. And I would say the same message for each of you right now. And our very own president for the Filipino Nurses Association of America, Ms. Natalie Liu, had the same message in her newsletter, in the newsletter of PNA America last month, where she challenged everyone to continue to prepare nurses, both at the undergraduate and graduate level, because we have the best nurses that we can develop. Continuing education, you've heard about that and you probably hear this enough, but I want you to think about this. Keep going. No update or no conference is too lame for anyone to attend. Even if at the minimum, it's a way for you to get energized and expand your network. Oh, this is one thing that I would really message strongly. So if there would be 2 or 3 key takeaways that I would leave for you tonight, one of them is to be involved. Be involved in a professional nursing organization. And you probably see on the screen, what's in it for me, WIIFM, right? What's in it for me? But time and time again, you'll probably hear, really in our profession, it's not really anymore all about me, but it's really about what we can do for our profession as well, and our patients and families, right? I can tell you and attest to you that who I am now as a professional is hugely because I became involved in my professional nursing organization, whether it's the Filipino Nurses Association, the Society of Gastroenterology Nurses, or here right now, we are with the Filipino Nursing Diaspora Network, who has this amazing goal and mission of fostering collaboration across the globe. If you Google professional nursing organization, you'll see hundreds of them. And I'm just posting a few of them here for you to choose from. And again, a quote, like, why do you get involved? And it reminds me of one of our Nurses Week's quotes in one of our activities this year at work. Mahatma Gandhi says and reminds us the best way to find yourself is to lose yourself in the service of others. Beautiful, right? I'll skip that, and I am just doing a time check. Dr. Lee, am I way over time?
Yes, my dear.
Okay. If you give me a few minutes to wrap this up, I will do that. So I will. Well, this is just my journey as a nurse, but we don't have time for that today. It's probably for another webinar or opportunity in the future. But this is where I work. I work at NewYork-Presbyterian Weill Cornell Medical Center in Manhattan. To give you a snapshot, we are a top 5 hospital in the United States. We are #1 in New York. And I'm sharing this with you because I am just really very thankful and proud to be part of this organization, and really proud of our Filipino heritage and training that we can really live up to the standards of a global and world-class organization. If you heard about the pap smear, Dr. George Papanicolaou, that came from our hospital, early history, Dr. Papanicolaou came from us, and the synthesis of penicillin, and I could go on and on. And I'm just sharing that with you with a lot of pride. So with the last few slides that I have, I wanted to share with you the inspiration that I have as we move forward with resilience in the challenge of the pandemic. That's in early April, or I think 2nd of April, I was really struck with an article that was written by Dr. Leo Jurado, who is the chair of the nursing department at William Patterson University here in New Jersey, where he published in one of our local papers. I really want to see the exact title here. It's covered by our screen right here. So it says, there's a good chance, okay, how catchy is that, right? There's a good chance the nurses taking care of you are immigrants. Let's clap for them too. And you probably have seen social media posts or news that 1 in 5 nurses in the United States is actually a Filipino. And if you ask me, what is our influence? What is our place in this pandemic and in making a difference? We are the difference, and we can conquer this because we were trained to do this, right? And in his quote here, I quote him, nursing is the exact opposite of social distancing. We provide comfort and care for patients, no matter how sick or contagious they may be in their most vulnerable moments when they are desperate for a kind gesture. We are there. And again, Dr. Jurado, I really have high regard for him to be one of the strongest advocates for nurse immigrants and Filipino nurses in the United States and around the globe. So we honor him during this week. A PNAA responded here by putting together a COVID task force. And I'll just do a quick flash here. I also am sharing with you some tidbits or pointers from our very own Vice President and Chief Nursing Officer, Dr. Roseanne Razo. I love the words grit and resilience and leader visibility as someone who's driving leadership at NewYork-Presbyterian. I will skip this, but this is Joanne Bosanke, who's amazing leader in the UK, whom I personally have worked with. I will skip that for another time. But I want to give time for our amazing colleagues. One of them is Dr. Warley Remigio, who is the PNA New York president, and again, a great colleague at New York-Presbyterian, Lower Manhattan, and he's the program director there for nursing professional development. He has been at the front and center of leading nurses through this pandemic, making a difference through recognition, inspiration, synergy, and empathy. If you can imagine how we were training, retraining, cross-training nurses in a marathon way because of the pandemic. And Warley here has been really instrumental to that. And again, here, someone who inspires me a lot, Janine Duran Lamzon, who is the Director of Nursing and Clinical Operations. If you have not seen her on ABS-CBN News yet, you can Google her name. And she has shown magical and amazing resilience throughout this pandemic. And I looked at when she was featured recently at nursecommander.com that features nursing leaders who have championed the pandemic. I think she posted that too on our polling question. Unleash your staff and you will make magic. Spread love to other departments through collaboration and looking at each tomorrow as a new day. And I also spotted today, Nurses Spotlight's Filipino Nursing Diaspora Day. I saw this on the website. Our very own Dr. Lee and Dr. Violeta Lopez, you were featured and we honor you. And I have the last few slides about the 2020 Year of the Nurse and Midwife, and which helps us, all of us, to really bring all together why do we continue to pursue excellence? Why do we need to continue to develop ourselves and be the best nurse that we can be? It's not at the end of the day only for us, but anything that we do for ourselves is something we do for our profession. So I invite you to look at the 2020 Year of the Nurse and Midwife messages on the World Health Organization site or the ICN, International Council of Nursing. And a quote that I would leave to you from Ogmandino, so an inspirational writer, is work every day as if it were your first, yet tenderly treat the lives you touch as if they will all end at midnight, which every nurse can relate to. And I am I'm out of time to discuss this, but make sure to take care of yourself. And there's really time for, if you want to keep going, you have to make sure you fill your bucket and find things that you love to do. At work, we actually have our self-care selfies contest for Nurse of the Year, just some ideas on how you're celebrating nurses. And we have a Year of the Nurse traveling nurse journal, which will go from unit to unit where nurses can actually write and do artwork and share stories. So bring it all together. How do you pursue excellence? You become an expert, find your why, seek a mentor, and really a quick plug here. These are all integrated into my new book, which is Fast Facts for Making the Most of Your Career in Nursing. And I will be happy to respond to you. And I'm totally out of time, but I have a video to show, or if we don't have time for that, I can also share that through an email later on.
We will put it on the website. This is Cindy.
Yeah. Thank you so much. Do I stop sharing my
Dr. Redulla, are you finished?
Yes, I am done. So
okay.
I think that is the conclusion. I would have loved to show the video, but I think I can share that with you, and you'll still get the message. It is the Johns Hopkins What's Your Next Big Idea video, which is their 2020 Year of the Nurse video, which has been viewed, I think, a gazillion times now across the world, but I would have loved to share that with you. But with that, thank you so much, and thank you for having me, and I'm happy to answer any of your questions.
Okay, with that in our mind, then I'm opening the question and answer section of our seminar for the day. Okay. Anyone?
There are some questions on the chat, I think.
Okay, let me see. I'll stop sharing my screen and go to the chat. Oh. All right, I have a question here. What do the hospital do to provide psychological support to nurses in general during this pandemic? I think this is a very, very good question. For our hospital, I would say, I can speak for our hospital, and I think many of the healthcare organizations across the United States have done this as well. But for us, really quickly, I felt immense support that was given to our nurses. First, not just psychologically, but they really first looked at firsthand what can they do to remove barriers to be able to have full presence when they are at work. And one of them is, provision of transportation, for example, when many of our nurses feared being in public transportation because fear was huge, and right now it's still really a reality. Providing housing close to the hospital, hotels, and all of that, and providing meals. So really taking care of the basics first and conveying that they are behind us. And second, we actually have a very robust Be Healthy or wellness program. So I think I would say that we were able to quickly use those platforms. We also already have what we call a wellness on wheels. You know, we hear about WOW in other acronyms, but we have wellness on wheels where, you know, we have our wellness teams leading self-care activities, providing healthy snacks, or there's on-the-go positive affirmations just to be able to get that renewal as a team. And we also have the support of our mental health department, mental health and behavioral department, providing virtual consultations and counseling, whether as a group or individually. And there are a lot of resources provided that we could easily avail of. Okay, so I'm looking at other questions here. Am I missing anything? Other than membership, what other strategies could the nurses do? Oh, mentorship. Other than mentorship, what other strategies could the nurses do to achieve their goals? Well, first, I think, again, I have made that as a highlight of the presentation, saying that, you know, find a way to be involved. And if in our hospital, you know, we have our shared governance platforms where I would really encourage our nurses, whether it's at the unit level, at the department level, or at the hospital level, find a way to be involved. And in that way, you learn a new skill, you get involved with a project. And really, when we say, okay, go out there, if I get a question like, oh, I want to publish an article, can you help me publish or write an article? First, what are you going to write about, right? You need to be, well, first you have to have a topic that you're passionate about, but one sure way that you can write about something, and Dr. Lee and Dr. Lopez, you know, echo me on this, you make sure that you are pursuing scholarly work, you are involved in a quality improvement initiative, or even in a community outreach activity. I am just sharing with you, for example, at our hospital, we have some unique community outreach events. For example, we have our taxi driver or cab driver community outreach event where we do health screenings for them, because as you know, some of our workers in New York may not have access to insurance. So that is providing them access, doing free clinics and everything. And, you know, documenting that and transforming that into a scholarly pursuit, and even, you know, a collaborative work in the community. Those are the beginnings of really pursuing your passion. How do we drag our fallible, procrastinating, pressurized, vulnerable selves to balance work, relationships, and conflicting demands and still achieve visible excellence? Wow, that is a really good question. And again, as I said, it's not easy at all. I have to tell you, right before this webinar, I was actually frantically preparing dinner to make sure that my kids are, you know, are fed before I step in here and, you know, do the webinar, and they're all ready for the night. But it's really, I think, maintaining the balance involves planning. You know, it involves strategic planning, but at the end of the day, your will to pursue excellence, your will to deliver whatever you want to achieve should be bigger than any of your negative vibe or anything that is stopping you from doing it. In our dialect or language, right? Kung gusto, maraming paraan. Kung ayaw, maraming dahilan. But I think that's better. It's easier said than done. But taking that in a bigger way, I think day to day, we just need to affirm that tomorrow I want to make sure I stay true to my goals. Okay, did I miss anything here? Are there Filipino nurses in our hospital? We have a lot of Filipino nurses in our hospital. Actually, I will be very proud to share with you that our chief nurse executive and chief quality officer is Dr. Willie Manzano, who is I think probably the first non-physician chief quality officer that has served our organization. Like, really amazing. And she is also a fellow of the American Academy of Nursing. And I just saw a comment here. Dr. Jurado is a Filipino Nursing Diaspora Network colleague. Yes, and I learned that he's one of the founding members of FIND. So that's amazing. Anything else? Okay, here. Emailed questions. Sometimes a lack of progress or huge resistance is a big sign that we are working on the wrong thing. If we continually feel uninspired, stressed, and pressurized, then we are definitely on the wrong track. What strategies can we do to overcome negativities, Ray Raymond? So that's really a very good question. I think many of us have that moment, and like I personally have that moment in my life, like what's next, where am I heading to? But I think when you are starting to get stuck on a thought or in your career or on a goal, it's really time to look for a mentor or a colleague whom you think can pull you back into the right way, right? Or into the positive path. And again, it's not easy, but sometimes it really just takes a conversation, a really good conversation to do that. But first, you have to make sure to reflect, again, go back. What are the things that you love to do? If you are pursuing something that you do not love to do, then don't even do it, right? So, and also I am a big endorser of keeping a journal, right? You don't have to write in it every day, but write your thoughts. It really has a healing effect. And who knows, that could be one of the journals we'll be reading in the museum one day because of the excellence that will come out of it. Yeah, and there's really a lot of ways to find ways to be energized. How do you uplift the morale of your nurses during this trying time? Yeah, so I've had the opportunity to speak with some of our nursing leaders who, especially in our ICUs, and really it is first leading by example, hands-on leadership, visibility, and I think as a team, when they huddle, they really make sure that they think about the positive progress that they've made, the day before, the previous shift, or looking at the milestones, and just really sticking together.
Rhoda, this is Cindy.
Yes.
Hello. I would just like to perhaps, before we finish the session this afternoon, to actually just, we all know that our FIND network colleagues are very expert clinicians, as well as many of them are PhD holders. I would just like to perhaps request you to talk a little bit about postdoc opportunities for our PhD holders and other career, for the career pathway of our network.
Okay, yeah, that's a very good question. And I think first I would start by saying, reflect on so far, like with your journey, your research journey so far, because I think many of them are either clinicians or researchers. What else? Like where is your niche? What gap can you fill in nursing, or even within your immediate, immediate work environment or work circle. And I know that when you are pursuing your postdoctoral studies, that should your goal should be very specific and it's very focused. So if you're looking, if the question, Cindy, is about like how, or is it more of like how is it looking? Like, are you asking specifically about the United States?
Most probably the United States, because for one, Australia will not have much opportunities, but I know, for example, that England and US and perhaps Canada would have more.
Right, yeah, we do. And I know that what they would typically ask for is that you should have established your research track or your track in general, and you have published and you have the ability to fill almost like a niche for grants, for obtaining grants, because a lot of them, our research centers are really driven by funding opportunities that come in these universities, in these research universities. I also know that it is both, there are opportunities for now. It used to be that only PhD holders have that opportunity, but I know that some universities are also open to the practice doctorate. I don't know if you have that in Australia, but we have that here in the US. Like my degree, the Doctor of Nursing Practice degree, some universities have opened that up, postdoctoral opportunities to DNPs as well.
So,
so for
Rhoda,
now, sorry. Yeah, if you ask me, for example, for me right now, if I'm thinking of me pursuing my postdoctoral degree, I'm really thinking about, I don't know if I had the opportunity to mention that in my talk, maybe not, but my doctoral focus has been on the care of hepatitis C patients. And if I'm applying for a postdoc right now, I would want to continue that research trajectory and really building on what I already have started to make sure that I already have established a track record within my field.
And Rhoda, for a PhD holder who would like to actually attempt applying for a postdoc, does it mean that it is their own responsibility to search for where to apply, how to apply, and all that?
Yeah, I think so. But I know that they're also always looking and posting. Like if you go to, whatever your university of choice or wherever area you're looking for, they usually post those opportunities. They're, some are very aggressive in looking for postdoctoral fellows. But again, the question is whether it's for up to them to find it. I think the answer is yes, because there are areas where it's more competitive than others.
Mm-hmm. And I guess the biggest perhaps contribution that we can do in the future for some of our young professionals who are very, as you said, in the pathway of being our nurse leaders will be for the FIND network to be able to help in assisting them if they need to have some sort of pathway or connections that would be needed and could be done through our network.
Absolutely, yes. And I think too, of course, as Filipino nurses, we have always the Filipino Nurses Association of America that can provide that platform for conversation. And at the same time, American Nurses Association, we're always, there's always opportunity for being part of, the global community and looking at those opportunities to partner and collaborate and welcome experts from across the world. So I think that's a great idea and great opportunity for the network.
Thank you. So unless there are any more questions, then what I would like to do now is to actually thank Dr. Rhoda for her very inspiring talk and thank also all of our participants today. And I am looking forward to meeting you in our next webinar, definitely. Okay? And at this point, I would now hand over to Dr. Lopez and Professor Jerome Babate.
Thank you very much, Dr. Rhoda. That was really a very inspiring presentation, and I am sure that the participants have learned a lot from your presentation and your roadmap. It was really great to hear the accomplishments of Filipino nurses in different parts of the world. And of course, as Cindy had mentioned, our FIND network is really hoping to expand this participation with other countries as well, not only from the 12 participant countries that we have included so far in our last COVID-19.